A 23-year-old man is referred to the gastroenterology clinic due to a 3-year history of recurring abdominal pain accompanied by cramps and diarrhea. The patient has noticed an increased frequency of episodes lately with worsening pain. He also says that his urine occasionally appears dark brown and his urine stream sometimes sputters. Imaging studies reveal a colovesical fistula. Biopsy obtained during colonoscopy shows chronic ileo-colitis with discontinuous transmural inflammation and non-caseating granulomas. When given the diagnosis of Crohn disease, the patient becomes skeptical and says, "There's no way I'm getting a colostomy bag." He then refuses treatment and pursues a second opinion once his symptoms subside. A second biopsy demonstrates reduced inflammation in regions of previously active ileo-colitis. The question is, an increase in which of the following cytokines is most likely responsible for this patient's clinical regression? Your options are A. Interleukin-1, B. Interleukin-5, C. Interleukin-10, D. Interleukin-12, E. Interferon gamma, F. Tumor necrosis factor alpha. If you know the answer, click the like button, and if you don't know the answer, keep watching. The correct answer is C, interleukin-10. The balance of pro- and anti-inflammatory cytokines in the intestinal mucosa is essential for homeostasis. Overproduction of pro-inflammatory cytokines leads to pathology such as that observed in inflammatory bowel diseases. Among the listed choices, interleukin-10 is the only cytokine with anti-inflammatory properties. Interleukin-10 reduces production of pro-inflammatory T1 cytokines, interleukin-2 and interferon gamma, and major histocompatibility complex class 2 expression, which is important for antigen presentation and T helper cell response. It also inhibits activated dendritic cells and macrophages. These effects of interleukin-10 result in the attenuation of cellular-mediated immunity with some enhancement of the humoral response, leading to a protective effect in Crohn disease. Do you even know your mistake now? If you are still confused, let me show you why the other choices are not correct. Choice A, interleukin-1, produced by macrophages and epithelial cells, has pro-inflammatory properties such as endothelium activation, increased chemokine expression, promoting leukocyte recruitment, and induction of fever. Interleukin-1 beta is important for differentiation of T17 cells. Choice B, interleukin-5 is secreted by T2 cells and promotes the humoral response by stimulating differentiation of B cells and increasing IgA production. It also promotes the growth and differentiation of eosinophils and is implicated in the pathogenesis of many allergic diseases, example, asthma. Choice D. Interleukin-12 is secreted by macrophages and induces differentiation of T1 cells and activation of natural killer cells. Choice E. Interferon gamma is secreted by T1 cells and promotes pro-inflammatory pathways by activating macrophages, increasing antigen presentation, and inducing the death of epithelial cells. Choice F. Tumor necrosis factor alpha, produced by macrophages, natural killer cells, and T cells, is a pro-inflammatory mediator that promotes leukocyte recruitment and activates the endothelium, increases expression of adhesion molecules. If your answer was correct, you have our permission to subscribe and continue to the next case.